Welcome to Tuberculosis Education, presented by the Grove Recovery Center. What is tuberculosis? Commonly referred to as TB. Tuberculosis is a serious illness that mainly affects the lungs. The germs that cause tuberculosis are a type of bacteria. Tuberculosis can spread when a person with the illness coughs, sneezes, or sings. This can put tiny droplets with the germs into the air. Another person can then breathe in the droplets and then the germs enter the lungs. Tuberculosis spreads easily where people gather in crowds or where people live in crowded conditions. People with HIV, AIDS, and other people with weakened immune systems have a higher risk of catching tuberculosis than people with typical immune systems. Drugs called antibiotics can treat tuberculosis, but some forms of the bacteria no longer respond well to treatments. Symptoms. When tuberculosis germs survive and multiply in the lungs, it is called a TB infection. A TB infection may be in one of the three stages. Primary TB infection. Immune system cells find and capture the germs. The immune system may destroy the germs, but some captured germs may still survive and multiply. Most people don't have symptoms during a primary infection. Some may get flu-like symptoms such as low fever, tiredness, and a cough. Latent TB infection. This stage is followed by the primary infection stage. Immune system cells build a wall around the lung tissue with TB germs. The germs can't do any more harm if the immune system keeps them under control, but the germs survive. There are no symptoms during the latent TB infection. Active TB disease. Active TB happens when the immune system can't control an infection. Germs cause disease throughout the lungs or other parts of the body. Active TB disease may happen right after primary infection, but it usually happens after months or years of latent TB infection. Symptoms of active TB disease in the lungs usually begin gradually and worsen over a few weeks. They include cough, coughing up blood or mucus, chest pain, pain with breathing or coughing, fever, chills, night sweats, weight loss, not wanting to eat, tiredness, pain near the site of infection, and not feeling well in general. Active TB disease in the voice box is outside of the lungs, but it has symptoms more like disease in the lungs. Common sites of active TB disease outside of the lungs include kidneys, liver, fluid surrounding the brain and spinal cord, heart muscles, genitals, lymph nodes, bones and joints, skin, walls of blood vessels, voice box also called larynx. When to see a doctor. The symptoms of tuberculosis are like symptoms of many different illnesses. See your healthcare provider if you have symptoms that don't improve with a few days of rest. Get emergency care if you have chest pain, sudden severe headache, confusion, seizures, or difficulty breathing. Get immediate or urgent care if you cough up blood or have blood in your urine or stool. Causes. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. People with active TB disease in the lungs or voice box can spread the disease. They release tiny droplets that carry the bacteria through the air. This can happen when they're speaking, singing, laughing, coughing, or sneezing. A person can get an infection after inhaling the droplets. The disease is more likely to spread when people spend a lot of time together in an indoor space. So the disease spreads easily in places where people live or work together for long periods. Also, the disease spreads more easily in crowded gatherings. A person with a latent TB infection cannot pass the disease to other people. A person taking drugs to treat active TB disease usually can't pass the disease after 2 to 3 weeks of treatment. Drug-resistant TB. Some forms of the TB bacteria have become drug-resistant. This means that drugs that once cured the disease no longer work. This happens in part because of naturally occurring genetic changes in bacteria. A random genetic change in a bacterium might give it some quality that makes it more likely to survive the attack of an antibiotic. If it does survive, then it can multiply. When antibiotic drugs aren't used correctly, or drugs fail to kill all the bacteria for another reason, the conditions are ideal for more resistant versions of the bacteria to get established and multiply. If these bacteria are passed on to other people, a new drug-resistant strain can grow over time. Problems that can lead to such drug-resistant strains of bacteria include the following. People didn't follow directions for taking the drugs or stopped taking them. They weren't prescribed the right treatment plan. Drugs were not available. The drugs were of poor quality, or the body didn't absorb the drugs as expected. Risk factors. Certain living or working conditions make it easier for the disease to pass from one person to another. These conditions increase the risk of getting a TB infection. Living with someone with active TB disease. Living or traveling in a country where TB is common, including several countries in Latin America, Africa, Asia, and the Pacific Islands. Living or working in places where people live close together, such as prisons, nursing homes, and shelters for homeless people. Living in a community identified as being high risk of tuberculosis. Working in healthcare and treating people with high risk of TB. If you test positive for latent TB infection, you may need to take the drugs to prevent active TB disease. Preventing the spread of the disease. Stay home, isolate at home, ventilate the room, wear face masks, and cover your mouth. This is the end of the training. Please proceed to the post-test. Thank you.